Hello, my name is Charlene Smith, and this is my strategic plan presentation on the Fruits and Vegetables Galore program, a comprehensive initiative that combines policy and programs to reduce childhood obesity by increasing fruit and vegetable consumption in high school students. Teen eating habits are impacted by many different factors. Peers, parents, their environment. They're probably snacking more and sitting down less for a real meal. So a lot of times they're consuming more empty calorie foods and not as many nutrient dense foods. We want to try to enforce healthy habits as often as possible. So we really want to create a good environment at home and at school for students so they can create lifelong habits. Research shows that in the past years, students are drinking less milk, consuming more soda, fruits and vegetable intake is steady, but screen time has increased and physical education has decreased. These factors and others could lead to an overall decrease in physical activity and an increase in weight for students. The target for this intervention is high school students in my home state of Pennsylvania. According to the Youth Risk Behavior Survey, and comparing data from 2009 to 2015, obesity rates are remaining steady at 16%. The rate of overweight has decreased to 18.1%. When distinguishing by race, there was an increase in obesity rates in the Black population. When working with this age group, it's important to remember that nutrient requirements differ greatly based on size, gender, and physical activity level. Calcium, iron, vitamin D, and folate consumption are important for all, but especially for this population. Many adolescents are consuming too much fat and sugar and are not meeting the dietary guidelines. Because adolescents are making many of their own food choices, they need to learn to work through the decision-making process, and programs should create an engaging message for them. The goal in working with this age group is to encourage them to eat a varied diet in order to consume all of the required nutrients. There are several policies and programs that can help students to make healthy choices that are already in place. In Pennsylvania, the competitive food policy holds that districts cannot sell non-nutritious beverages and foods during the school day. This means that they cannot be high in fat, sugar, calories, etc. The only beverages that can be sold are milk, water, and 100% juice. These guidelines apply to a la carte, school stores, classroom parties, food rewards, fundraising, etc. Additionally, districts need to follow all of the national guidelines set forth by the school lunch program. If districts are following competitive foods policy and federal guidelines for the school lunch program, this can help students to increase fruit and vegetable consumption during the day by reducing the availability of minimally nutritious foods and increasing nutrient-dense foods. Ideally, these would include fruits and vegetables. In addition to foods served in the cafeteria, this policy addresses classroom parties, which should also follow the guidelines. The Healthy Farms and Healthy Schools programs educate specifically kindergartners and their families about the importance of choosing healthy, locally produced foods. They also offer grants to increase awareness and availability of local agriculture in schools. They help to provide reasonably priced local produce for cafeterias. If these programs were expanded, this could further increase students' fruit and vegetable intake and support local farms. In Pennsylvania, students from grades K through 12 are required to receive health, safety, and physical education. This includes skills in nutrition. Schools do not need to follow a specific curriculum. They are just required to accomplish all of the necessary standards. In order to improve nutritional knowledge and improve fruit and vegetable consumption, a research-based, pilot-tested program could be recommended to all districts so that they achieve more success in this department. More than 30 million students receive school meals each day, and many rely on school foods for up to half their daily calories. As a result, school-based interventions that encourage the selection and consumption of healthier food components can have important health implications. Improving school food palatability should be a priority to improve students' diets. If the students do not consume the food, they cannot reap the nutritional benefits. It's imperative that students enjoy the healthy food that is offering. Collaborating with a chef to improve quality and palatability and using choice architectural techniques have both been found to increase fruit and vegetable consumption. Some techniques include placing healthier foods first in a buffet line, placing white milk in front of sugar-sweetened milk, and using verbal prompts and lighting on healthier foods. The Fruits and Vegetables Galore program is a tool for school food service professionals that provides tips on planning, purchasing, protecting, preparing, presenting, and promoting fruits and vegetables. This program could be used alone or in combination with a nutrition education program. We're going to focus on it being used alone. A joint effort between classroom teachers and food service would likely yield better results while helping to create a school climate that promoted wellness. This program aims to make daily meal offerings competitive with other commercial options available to students. Some of the materials are geared toward a younger audience, but could be easily modified for high school. The food service director would be responsible for implementing the program, but would need administrative and school board approval. If a nutrition education program was selected, that would require approval as well, and teachers would need to teach the curriculum and evaluate the program. The role of food service is very important in this program, and food service might require additional training to implement the program. They should already be ServSafe certified, but they would need to continue that certification because of all the fresh fruits and vegetables that they would be serving and preserving. There are many stakeholders that will need to be involved in this process. The Pennsylvania Department of Education will need to continue to monitor school wellness policies to ensure that districts are meeting the guidelines for competitive foods and the school lunch standards. They need to promote and expand the Healthy Farms and Healthy Schools grants to include high school instruction and support additional elementary schools. They would also need to recommend specific curriculum for nutrition education so that we know that it is a reliable, valid assessment. At the district level, school boards and administrators need to enforce their district's wellness policies. This requires buy-in from parents, students, staff, and community members because it will likely cause change and there could be resistance. The staff could resist change in curriculum and in classroom parties. Students and parents could also resist the change in foods offered at the cafeterias and restrictions on classroom parties. Communication with all stakeholders will be critical. Information can be shared with parents through PTO meetings, the district website, the district Twitter, and the district Facebook page. The policy should be shared and explained. There should be time for question and answer. State, national, and local data on childhood obesity should be shared so that they better understand the reasons behind the policy. This information will be useful for students and staff as well. Staff should be provided with alternatives for rewards and classroom parties because this is likely a big change for them. Studies show that social marketing strategies seem to be effective methods to increase awareness, positive attitudes, and knowledge towards increased fruit and vegetable consumption with high school age students. Over time, the culture of the district can change to one that promotes overall health and models appropriate healthy behaviors. The amount of fruits and vegetables consumed could be evaluated with a fruit and vegetable count at the point of service or an assessment of fruit and vegetable waste. Students could be surveyed to see how they like new foods and recipes could be changed due to these findings. And this is all part of the Fruits and Vegetables Galore program. There should be minimal cost associated with the implementation of these changes, and no additional personnel should be required. Though some changes would be made to the menu, costs should remain the same. Ideally, revenue would actually increase because more students would be eating the school lunch. Food service directors may need some additional training in order to design the new menu and to preserve the additional fresh produce. Funds could be received through the Healthy Farms and Healthy Schools grants, and Lighten Up Lancaster, a local health coalition that offers grants to support school gardens and farm-to-school programs. Thank you for taking the time to review my strategic plan on the Fruits and Vegetables Galore program.